Respiratory system is the most important topic to study for the NCLEX exam. So today let's go through some conditions and their managements. In case of asthma, there is narrowing and inflammatory status of the airways. For the NCLEX tip, you need to know the asthma attack or status asthmaticus, which is also known as asthma exacerbation. In this case, there is constriction in the airways, which causes tightness and difficulty in breathing. So this is the condition. We need to keep it on priority and immediate intervention is needed. For the management of conditions, we provide high polar position for the patient, oxygen therapy, IV fluids, long sound assessment, monitoring pink flow, reducing patient anxiety, providing calm environment. For the short acting, we use albuterol. For the long acting, we use salmeterol. Plus, we also used in severe cases leukotriene modifiers like montelukast. Okay, now let's go to the COPD, which is chronic obstructive pulmonary disease. The symptoms are same as asthma, like cough, dyspnea, wheezing, crackles, weight loss. COPD is the chronic condition. Finger clubbing, barrel chest are the symptoms which differentiate COPD from other conditions. Okay, the nursing interventions for the patient with COPD are: we provide forward position, we provide oxygen therapy, which are the supportive treatment. Plus, we provide high calorie, high protein diets in a small amount but frequently. We avoid large heavy meals due to compression on the lungs from the stomach. We encourage patient for pause sleep and diaphragmatic or abdominal breathing. The key to remember is we provide low rate of oxygen, which will help to stimulate the breath due to the low oxygen. We use corticosteroids to decrease inflammation and mucus production in the airways. We also use bronchodilators to dilate bronchi or bronchioles or for the easy breathing of the patient. We also use the nebulizations. The next topic is pneumonia, which is also known as lung infection. There are two types of pneumonia: community acquired pneumonia and hospital acquired pneumonia. The symptoms and nursing managements are likewise same as the conditions we studied before. The medications used in pneumonia are depending upon the cause, like bacterial, viral, fungal. Antibiotics like azithromycin, amoxicillin, doxycycline are mainly used in these conditions. Antipyretic and pain reliever are the supportive treatment for the pneumonia. The next topic is pneumothorax. In this condition, there is air accumulation in the pleural space. For the NCLEX, the main thing you have to know is tension pneumothorax. This is the medical emergency. For the priority question, you have to know the key symptoms like decreased or absent breath sounds, unilateral chest expansion, distended neck, ventricular deviation on unaffected side. Treatment options are like needle decompressions, chest tube drainage are the main management of pneumothorax. For the nursing interventions, we need to monitor the lung sounds as there is absent or decreased breath sound on the affected area. Regular vitals monitoring, oxygen therapy are also needed. Being a nurse, we need to watch for the air leakage on the chest tube drainage system. Okay, now let's go to the cystic fibrosis. This is the genetic disorder which mainly affects to the exocrine gland. In this condition, there is CFTR gene mutation, which stands for cystic fibrosis transmembrane regulator. If there is cystic fibrosis transmembrane regulator imbalance, which can lead to the improper sweat, mucus, tears, and digestive enzyme problems in the human body. In the NCLEX exam, we get so many SATA question, we get so many like case study type questions. I also had one question from these topics. So knowing such complications from this condition is crucial to solve such questions. So the complications from these conditions are mainly the respiratory, digestive, integumentary, and reproductive problems. Now let's go on nursing managements that are we need to focus on patient mucus nutrients, treatment of infections. People with cystic fibrosis are prone to infections like lung infection, gastrointestinal infections. We need to provide adequate stool softeners, pancreatic enzyme supplementations. In case of infection, we need to start the antibiotic therapy. Nasal spray are also used for nasal blockage. And the mucolytic and bronchodilators are also used to dilate the bronchi and easy airway passage.